Hi everybody at home, I hope you're doing okay. So this is going to be part one of chapter 3, the government's role in U.S. healthcare. We're going to cover most of the governmental organizations that are involved in healthcare, and there's going to be a part 2 that's assigned to everybody as homework, so be looking for that also, and make sure you do both near-pod activities. All right, so the learning objectives for Chapter 3, we're going to look at the U.S. governmental organizations and their role in healthcare. We're specifically also going to dive a little deeper into DHS, Homeland Security, and then FEMA, and look at the FDA. And part of your homework assignment, you can have a little assignment on how the FDA approves a drug. And we can also look at the role for CMS, Medicare, Medicaid services, although I'm going to reserve getting deeper into Medicare, Medicaid until we get into the financing chapter. So did you know that the U.S. Surgeon General is the chief educator in the United States? He often issues warnings and stuff. The FDA is responsible for accrediting and inspecting mammography facilities. And the DHS is responsible for ensuring that all government levels have an emergency preparedness plan for catastrophic events. Interesting to note, though, so you know our College of Nursing and Health Professions has a disaster management emergency preparedness, so it's DPM, Disaster Preparedness Emergency Management, sorry about that, department. And there are several degrees. There's a bachelor's and there's a master's and stuff, and that people can go through that training, and that allows them to help direct governments and hospitals and facilities like that during like how to respond to catastrophic events, because they have to have a plan in place now. So let's talk a little bit intro to how the government got involved in healthcare. So during the Depression, which is like 1927, and World War II, which is between 1940 and 1945-ish, the U.S. had no funds to start a universal healthcare program. We just came out of the Depression, and then from there, we were, recovering, and then went into the Second World War, which of course used up a lot of resources and stuff. And so this is an issue that they had discussed for years, and especially with the beginning of health insurance and all that showing up. Okay, so as a result, private sector system was developed, but because it's private sector, then it did not cover all citizens. And so this is kind of where we've come out of and where we still are in some fashion today. So, however, the government's role of providing healthcare coverage did evolve, and it evolved as a regulatory body to ensure that the elderly, at least in the poor, were able to receive healthcare. So we're taking care of the vulnerable people in our population. So it started really with the passage of the Social Security Act of 1935. So that was post Great Depression, but before the Second World War, and the establishment of Medicaid and Medicare in 1965. So 1965 is after Second World War. It's actually around Vietnam War, and so that was mandated. And it increased the government's role in providing healthcare coverage. Again, Medicaid was to provide care for the poor. Medicare was to provide care for the elderly, and they've been in place ever since. Then the latest one has been the Affordable Care Act, and it has increased government interactions with the healthcare system. It has developed several government initiatives that focus on increasing the ability of individuals to make informed decisions about their healthcare and also have access to healthcare coverage. Okay, so let's look at governmental activities in healthcare. So social regulation focuses on action such as those in the healthcare industry that impact an individual's safety and well-being. So they're not, we're just going to look at it just in healthcare, but social regulations in general are like, seatbelt regulation is a form of social regulation. Again, it is really for your safety. Regulatory healthcare power is shared among federal and state governments. So again, some of the federal one is just kind of delegated to the state, and then the state tends to just manage more of the day-to-day, the operations within the state. State governments have a dominant role regulating the constituents in their jurisdiction. So again, there'll be more like state and local governments will be more like the boots on the ground, whereas the federal tends to just provide the money and guidance and regulations and all that for what to do and help pay for it and stuff like that. So state governments also developed local government levels, obviously, to provide direct services to the constituents and regulate their geographic regions. So this increases access. So if we all had to go, for example, to Little Rock to get any kind of access to the service provided by the Arkansas Department of Health, then it would be an issue. Instead, they have local offices all over the regions and stuff and counties, so that there should be something within a reasonable distance of where you live. The legal authority of the state governments is derived from legislatures that establish the legal framework for their authority. So everything that they do or can do is first written in law, in its state law. All right, so let's start with, we're going to look a lot at the federal ones. So the first and most important one is the U.S. Department of Health and Human Services. This thing is a monster. It is the most important federal agency with regards to healthcare, and it gives cabinet-level executive branch. It's a cabinet-level executive branch of the federal government. So it's has to do with putting the legislation stuff in action, into actual programs, financing it, and all that kind of stuff. It has 11 operating divisions, which we're going to discuss on the following slides. It collaborates with state and local governments because many of the activities will, of course, happen where people are, which are going to be at state and local levels. So one of the first is the CDC. So the Centers for Disease Control and Prevention. It was established in 1946. It is headquartered in Atlanta, Georgia. It is a massive facility. It would be really cool to work there. Their mission is to protect the health and promote the quality of life through the prevention and control of disease, injury, and disability. So they are involved in many, many, many aspects of public health. They've been at the forefront of the response to the coronavirus pandemic. But I mean, that is by no means all that they do. It's not just disease outbreak. They also track obesity, they track heart health, and all kinds of stuff. So public health is really the key word for CDC. All right, so when you have a minute, explore a little bit the CDC, but you can see, okay, they're at the forefront of coronavirus disease response. But they also do, for example, flu vaccines to help respond to hurricanes and tropical storms and stuff, addressing youth and e-cigarette use, addressing wildfire smoke and COVID-19. They will report different outbreaks and stuff like that. So there's some peaches infected with salmonella, onions infected with salmonella, and of course, pandemic, yeah, we know coronavirus is an outbreak. And then another outbreak that's been pretty prominent and was really in the news a lot more before coronavirus was e-cigarette use and vaping and the damage it does to lungs and stuff. And so you can just find out a little bit more about that, but you should definitely explore the CDC website. So just to see if you were paying attention, according to the front page of the CDC website, which of these fruits might be tainted with salmonella? So pick the right one. Okay, so the next one is the Administration for Community Living, or ACL. This is a newer one, so it was established in 2012, so that is a couple years after the ACA, the Affordable Care Act. The ACL brings together efforts from the Administration on Aging, the Administration on Intellectual and Developmental Disabilities, and of course, Health and Human Services, which is again the big umbrella office, and their Office on Disability. So Health and Human Services is the big one, and this is one of the branches is ACL, but it was tied to the Office of Disability that was under the Health and Human Services. And so it is serving as the federal agency that is responsible for increasing access to community supports while focusing attention and resources on the unique needs of either older Americans or people with disabilities across the lifespan. So the idea about the Administration for Community Living is trying to keep our elderly at home if possible and not have to institutionalize them. Same thing with people with disabilities. Can you keep them at home? Can they have some form of independence? And then like if you have to provide, you know, maybe transportation back and forth to work or somewhere because they can't drive, then maybe that's a service that the ACL can provide. Or if they have to organize, you know, maybe the person with disability can't cook, so maybe they organize to have meals delivered and all of that. So this video here is a little bit about what they do. It's only a couple minutes long, so I encourage you to watch it. And then our third one is the Agency for Toxic Substances and Disease Registry, or ASTDR. So this is the federal public health agency that determines human health effects associated with toxic exposures and preventing continuing exposures, and also trying to mitigate or lessen associated human health risks. It is administered by the CDC or with the CDC in conjunction with the CDC. So they're looking at toxic stuff. And so just to give you an idea, we have over the last few decades have increased the amount of chemicals in our environment. There's I think about 80,000 now chemicals that are used, whether it is on plants and foods that we eat, or in personal care products, shampoos, deodorants, all that kind of stuff, makeup, cleaning products. There's so many things, plus everything that's used for industrial uses and all that. So there's definitely risk for toxic exposure. So I'm going to open the web page here and put it here. So here is their website, and I put a little bit, see glyphosate's up here. It's one of the, they finally put a final tox profile. So if you have regular TV, and even if you just watch on YouTube and stuff like that, if you've seen ads, there are lawsuits against the makers of glyphosate, which is in Roundup, because it causes cancers, especially like lymphomas and stuff. Anyway, so you could go look up the health effects and you know, toxic profile and all that of glyphosate. And so, for example, this is to give you the idea. And why do we use Roundup and glyphosate so much? They use it on crops. They found it's really good at drying out crops, especially cereal type crops, and preventing from molding. So, okay, that's good because we don't want to have crop loss, and we don't have mold to affect it. But it's a carcinogen. It's not good. It's never been good for us, and they've increased the use. And so this is where it's the most used, which is, of course, a big agricultural area right here. So with the purple being the heaviest use and the green being the least use. So we're right here in an area of heavy use, being here in Northeast Arkansas. And it's our exposure. I mean, this is crazy. Like most brand name cereal, if they're not organic, have measurable levels of glyphosate in them because of this type of use, and yet it's not listed. It's also somewhat tied to the obesity epidemic. So if you can see, it's the same area that have a problem with obesity and stuff. And so part of it is one of the ties is it gets into our food system, and it can cause inflammation in the gut and in the lining of the intestines and stuff, and then that can cause all kinds of GI problems, and the inflammation can, you know, over time lead to obesity and stuff. So I just thought it was kind of interesting to see that. So next, we're going to talk about the National Institutes of Health. So the primary federal agency for research, that's NIH, and they do all kinds of research. What it is they actually mostly are funding research. So there's research going on campus that is being funded by grants from the NIH. There are 27 institutes and centers that focus on different diseases and conditions. And some of those are cancer, ophthalmology, heart and lung and blood, genes, aging, alcoholism and drug abuse, infectious disease, chronic disease, children's disease, and mental health. And so there's an institute for each of those. And so here I'm going to show you a little bit what they've got going on. So of course there's research going on COVID-19. So, but here are some of the NIH medical research initiatives: accelerating COVID-19 therapeutic interventions, the 21st Century Cures Act, the rapid acceleration of diagnostics, NIH wide strategy plan for COVID-19's research, like how they're financing, what are they putting their money towards, and all, what all is going on, who's doing what. There you go. Cancer Moonshot, the Brain Initiative, and there's a trans NIH-ME chronic fatigue syndrome, smyeloencephalitis chronic fatigue syndrome working group. So this is a good one too. And environmental influences on child health outcomes program. And just look at all of these things that we have going on here at the NIH. All right, so I'm gonna close this, keep going. And then if you want to see all the centers and stuff like that, no, we're not taking a survey. So here's the office, but then here's all the institutes: the Cancer Institute, Eye Institute, Heart, Lung, and Blood, Human Genome, etc. I mean, look at all of these: biomedical imaging and bioengineering, arthritis, musculoskeletal skin diseases. It's just, they have a lot going on. This is a big monster. It's a big organization, a big governmental organization. So, which website would have up-to-date information about the COVID-19 pandemic? Select what you think your answer. Where would you go? Then next we have our Health Resources and Services Administration, or HRSA, and so their goal is to improve access to healthcare services, especially for people that are more medically vulnerable, uninsured, isolated, etc. There are tens of millions of Americans that can get affordable healthcare and other help through these programs, and there are more than 3,000 different grantees. I thought I would share this because a friend of my daughter has used this program. So here's the HSRA. They have the Ryan White HIV/AIDS program. So one of the problems is if you have HIV/AIDS, is sometimes it's hard to find work, and if it's hard to find work, it's hard to find lodgement or housing and stuff like that. And then that, both of those things also make it hard for you to stay on your medication regularly and stuff like that. So it's a comprehensive system of HIV. They get their medical care, but also support services. So they help pay their lodging, rent, and stuff like that. They provide medications for low-income people that live with HIV and are either uninsured or underserved and stuff like that. And so this is a really cool Ryan White HIV/AIDS program parts. There are different parts to it depending on what you qualify for and what you need and stuff. So, and this is just one of the programs out of HRSA. Okay, so if you want to know what the latest COVID-19 research efforts were, where would you go? Go answer that. And your Indian Health Services, the mission is to raise the physical, mental, social, and spiritual health of our American Indians and Alaskan Natives. And so they have their own separate system so that we can give them culturally acceptable, appropriate healthcare, comprehensive healthcare services. This is serves about 1.9 million American Indians and Alaskan Natives who belong to about 566 federally recognized tribes. Then we have the Substance Abuse and Mental Health Services Administration, and this is the main federal agency to improve access to quality substance abuse and mental health services in the United States. They work with states, community, and private organizations. So they would provide funding for programs, for access and stuff like that, and for services for people that need it. And then we have the US FDA. So this is another big one, okay? They're responsible for ensuring that the following products are safe: our food, our human and veterinary products, or pet food, yeah, I was like, human products, I mean, it's like pretty much anything that goes on the market that can be ingested or applied to our bodies and stuff like that is going to be regulated by the FDA. Biologic products, like vaccines and stuff, medical devices, anything that would monitor anything on your body or go inside your body in any kind of way, cosmetics, electronic products, all of that. So drugs, food, biologics, medical devices, cosmetics, like personal care products. There's a bunch of stuff that's regulated by the FDA. It is also responsible for ensuring that consumer product information is accurate. So a lot of the labeling laws and stuff come out of rulings from the FDA. And that's why a lot of times if you look on some stuff like some of the things that the FDA regulates is what kind of claims you can put on labels. And I know that you cannot make disease claims on especially like supplement labels and stuff like that, but you can make body system support claims. So you can't say this can help for if you have coronary heart disease on the supplement, but you can say this supports heart health. Okay, and so that's the kind of things that the FDA regulates, and the labeling of what's in whatever it is that you're taking. They also advance public health by speeding up innovations to make medicines and food more effective, safer, and more affordable. So there you go. The Administration for Children and Families. It is responsible for federal programs that promote the economic and social well-being of families, children, individuals, and communities. And this is also, single parents and everything like that. They have 10 regional offices. And one of the things I do like about that, I'm going to open their webpage here. So a few highlights and stuff. Safe return to school puts kids first. Here you go. Tribal programs for COVID-19 questions and answers. They do a lot. And we're not going to spend a lot of time here, but one of the things I do want to say is one of the work that they are involved in is stopping human trafficking. So this is a very short video, is less than a minute, on human trafficking and stuff. And so just again, be aware that there are people even here locally. They're ferrying people sometimes through Jonesboro or grabbing people from Jonesboro and taking them usually to bigger cities where there's a bigger demand for this kind of stuff, which is just mind blowing. Anyway, stopping human trafficking is part of what they do also. So CMS, Center for Medicare and Medicaid Services, this is another giant governmental institution. So it was established in 1965 as a result of the Social Security Act. It has over 20 offices that oversee different aspects of their programs, but their goal is to provide policy, funding, and oversight of healthcare programs that serve elderly and poor. So elderly are covered by Medicare, the poor are covered by Medicaid, and they set things like reimbursement prices, a lot of the rules and regulations of who's eligible, who's not, how it's covered, how much things cost, and all of that is like put into policy and put into rules. And every year they publish, new rules and new things and updates and all of that. And pretty much the entire healthcare system kind of follows whatever they do. Because if you don't follow the rules established by CMS, then you cannot get reimbursed. So for a health institution like a hospital, if they don't follow the rules established by CMS, they cannot file for reimbursement for patients that came in that are covered by Medicaid and Medicare services. So pretty much whatever CMS says, everybody does. The insurance companies will tend to follow suit and kind of do the same kind of rules, and the hospitals have to follow the rules and the things that they put in place. So as part of the Affordable Care Act, the Innovation Center was established for the purpose of testing innovative payment and service delivery models to reduce program expenditures while preserving or enhancing the quality of care. So for people that receive Medicare, Medicaid, and the CHIP is Children Health and Infant program, I believe, but it's what here in this state we call AR Kids First. And so it's kind of an expanded access to Medicare, I'm sorry, to Medicaid, especially for children and stuff, for kids under 18. So, and the idea is that this is such a massive governmental, organization, that there's Medicare fraud, so there's misuse of funds going on and all that. And also, because it's such a big institution, it's hard to monitor everything. So finding basically efficient ways to use the money to get quality of care is a good, it's a good way to operate. And so they're looking, and so what they do is they're looking for input from hospitals and stuff like that, and saying, hey, we have seen that this and this works, so let's do it a certain way, and they try it out, and if it works, then it can be implemented to other hospitals and stuff like that across the nation. So Occupational Safety and Health Administration, OSHA, is established to govern workplace, make sure the workplace is safe and healthy. So they have a lot of the rules regulating in healthcare the use of PPE, so gloves, maybe lab coat, other protective equipments. Now, of course, with coronavirus, all the masks and the shields and that kind of stuff. But even in manufacturing and stuff like that. So all having the appropriate safety glasses and headgear and all that kind of stuff. The employers have to make sure that they provide it to their employees, and OSHA, make sure that they can enforce that. So, for example, if you work in a place that was not following safety protocols, was not providing what you needed to safely perform your job, you could report your employer to OSHA, and they would come down and inspect and see what's going on, and they could fine them for not following the rules. Then we have the Surgeon General and the U.S. Public Health Service. So again, as stated earlier, the Surgeon General is the nation's chief health educator. The Surgeon General puts out information on how to improve the health of the U.S. population. It is a position that is appointed by the President, and the Office of the Surgeon General will oversee the operation of the Commission U.S. Public Health Service Corps. And the U.S. Public Health Service Commission Corps consists of over 6,000 public health officials who are stationed in federal agencies and programs and stuff. So some of them might be stationed in the CDC and Arkansas Health Department and all that kind of stuff. And their main goal is to increase public health. So here is our Surgeon General, in case you didn't know. It is, can't remember the ranks exactly, but it's Jerome Adams. And I think it's Vice Admiral, but y'all correct me if I'm wrong. Jerome M. Adams, he's a doctor, obviously, MD, and he has a master's in public health. And you have all his contact information and all of that. He is the 20th Surgeon General of the United States. And his motto is better health through better partnerships. So there you go. And now let's talk a little bit about Homeland Security and a Federal Emergency Management Agency, or FEMA. So Homeland Security was established in 2002 after the 2001 terrorist attack, which we just had on memorial for 9/11. And it combined 22 different federal departments and brought them together to form the Department of Homeland Security. And then FEMA, which is responsible for managing catastrophic events, was first separate from the DHS, but then was integrated into Homeland Security in 2003. So now you see it's actually Department of Homeland Security, and then it's FEMA. They are responsible for coordinating all efforts to ensure emergency preparedness for any catastrophic events, but of course then also the response during catastrophic events. So catastrophic events are bioterrorism, chemical and radiation emergencies, mass casualties, so like tornadoes and stuff like that, hurricanes, and disease outbreak like coronavirus. And so FEMA does a lot of the responses to those things, but they are under Homeland Security, and of course when you think about it with bioterrorism, it kind of makes sense. All right, and then we have the Office of the Assistant Secretary for Preparedness and Response, and it was created under the Pandemic and All Hazards Preparedness in the wake of Hurricane Katrina. And the goal is to prevent, prepare, and respond to the adverse health effects of public health emergencies and disasters. So think about, you know, Hurricane Katrina, all the displaced people and all that, and what was going on in Louisiana, and how it affected the city. If you had been left behind in the city, what are problems that you could have? For example, no access to clean water. Everything is underwater. Then after that, even after the water recedes and goes back, then you have the problem of everything being wet and the mold contamination and dead stuff, probably animals and probably dead people and stuff that'd been like floating in water and houses and stuff like that, and the potential contamination of water by all of that. And so there's being able to appropriately respond to these types of things, as they're coming, the evacuation process, but then also, afterwards. And so, it focuses on preparedness, planning, and response. It builds federal emergency medical operational capabilities, countermeasures research, so like what could work to protect areas like southern Louisiana and stuff against hurricanes. Advanced development in procurements. So yeah, countermeasures, research, advanced development and procurement. Grants to strengthen hospitals and healthcare systems in public health emergencies and different medical disasters. Because of course a lot of this is going to cost more. You're going to need more resources. You're going to need all hands on deck. Can you imagine having to move all the patients in a hospital in a really short amount of time? That takes a lot of coordinated effort because you have to have transport and care of some of these patients while in transport and stuff. It's definitely quite an undertaking. Okay, so which agencies are involved in our coronavirus response? So you can select more than one. Just select what you think. Here you go. Here's a big old long list. Okay, so in conclusion, for our part one, the federal government plays an important role in the quality of U.S. healthcare, and it provides funding for the state and local government programs. So that would be the state and local is going to be part two. Federal healthcare regulations are implemented and enforced at the state and local levels. So they're made at the federal level, but they're enforced at the state and local level. And then the funding is primarily distributed from the federal government to the state governments, and they then allocate it to the local health departments, which then manage the day-to-day operations. Okay, and your last slide is, if you have any questions, you may put it there, and I will check them and answer them. And I hope you guys have a good day.